Hello and welcome to Med Simplified. In a previous video that we made on diabetes, we were getting a lot of questions and feedback from all of you regarding diabetes. A lot of those questions turned out to be commonly spread misinformation and myths about diabetes. So, in this video, we decided to tackle some of those myths and try to find out if there was an actual truth behind them. Myth number 1. People with diabetes can't eat sugar. This is one of the most common myths about diabetes, that people have to eat a sugar-free diet. While eating excess sugar is certainly bad for you, sugar is what your body uses as a fuel. If you stop eating the required amount of sugar, you are actually hurting your body. That is why people with diabetes need to eat a diet that is balanced, which can include some sugar in moderation, with optimum levels of protein, balanced amount of healthy fats and carbs. Also, they should eat fiber-rich foods such as fruits and salad, which promote glucose control and gut health. Myth number 2. Type 2 diabetes is a mild disease. This diabetes myth is widely repeated, but of course it isn't true. No form of diabetes is mild. When the body fails to control its sugar levels, it leads to serious, even life-threatening complications. Cell injury and inflammation leads to vision problems, heart problems, blood vessel problems, kidney problems, liver disorders, and whatnot. Virtually every organ of the body is susceptible to damage due to diabetes. Diabetes causes approximately 4 million deaths each year, but good control of diabetes can significantly decrease the risk of complications. But this doesn't mean that the condition itself is not serious. Always prioritize your health above everything else. Myth number 3. Diabetes cannot be cured and it is a lifelong disease. While it's true that a permanent cure for diabetes has not been found, but diabetes can be brought into remission, especially in the early stages. Doctors use the term remission when diabetes is brought under control. When you are told that diabetes is in remission, it means that there are no more outward symptoms of the disease. It can be a partial remission when the blood glucose level is lower than that of a diabetic for more than a year without medication. Remission can also be complete when blood glucose has returned to normal for at least a year without medication. And it can also be a prolonged remission, that is when the blood sugar levels have been normal for at least 5 years. If detected early and managed properly, there is a good chance of ensuring your diabetes will go into remission. Managing your diet, exercising regularly, taking proper medication, avoiding stress, and regular checkups with your doctor will help you to get your diabetes under remission. Myth number 4. Diabetes only affects people who are obese. Overweight and obesity are risk factors for type 2 diabetes and gestational diabetes, but the condition can occur in people of any weight. According to data from CDC National Diabetes Statistic Report 2020, 11% of the people with type 2 diabetes in US are neither overweight nor obese. Also, according to the CDC, an estimated 39.8% of adults in US have obesity, but only 13% have diabetes. Type 1 diabetes has no associations with body weight. But that said, in people who are both overweight and diabetic, losing weight can have a big impact. Although it might not cure type 2 diabetes, getting to a healthy body weight does lower the need for insulin therapy or other medications to control diabetes. It also lowers the risk of other serious complications of diabetes, including heart and kidney problems and nerve damage. Myth number 5. People with diabetes should eat diabetic-friendly foods. Diabetic food is an emerging myth I have seen in the past few years. Manufacturers will often use the label diabetic friendly for sweet foods in which sugar alcohols or other sweeteners will be used instead of sugar. With a very low to even 0-calorie sugar count, artificial sweeteners may seem like a treat for people with diabetes. But recent research indicates that artificial sweeteners may actually be counterintuitive, especially if you are looking to manage or prevent diabetes. Another 2014 study found that these sugars such as saccharin can change your gut bacteria composition. This change can cause glucose intolerance, which is the first step towards diabetes in adults. So, to be on the safer side, try to limit your total added sugar intake rather than switching to sugar substitutes. Also, to know the best foods for diabetes, watch a video on this topic by clicking the I button above or the link in the description box down below. Also, to know the best food for diabetes, watch our video on this topic by clicking the I button above or the link in the description box down below. Diabetes is no longer a death sentence like it was in the 20th century. Back then, the only effective treatment was a strict diabetic diet, which meant incredible weight loss. Drugs like insulin have revolutionized the way we treat diabetes today. Thank you so much for watching this video. I hope we cleared some of your myths regarding diabetes. Share this video with your friends and family to spread the information. If you like the video, don't forget to like and subscribe to our channel. We are committed to bringing you more content. You can support us by becoming a member on our YouTube channel and on Patreon. Thank you so much and see you in the next video.